So, thoracic outlet syndrome. So, in this video, we are going to discuss about the special test for a physical therapist to evaluate thoracic outlet syndrome. So, thoracic outlet syndrome, where there are three structures that are compressed in the thoracic outlet, that is brachial plexus, subclavian artery, and subclavian vein. So, today we are going to talk about three tests: Adson's test, Costoclavicular Syndrome, or in other words, military brace test, and the third is a Halsted maneuver. So, when it comes to special test for thoracic outlet syndrome, it is very important to reproduce the signs and symptoms one more time, in addition to diminished pulse. Why? Because if a patient has a more neurological symptoms, then patient will experience numbness, tingling, weakness in the grip, or loss of manual dexterity. Where if the patient has more the arterial symptoms due to subclavian artery, patient will feel a cool extremity or diminished pulse. And if the patient has more the venous symptoms where the subclavian vein is affected more, then the patient will have swelling or a discoloration of the extremity. So diminished pulse is an important component, but reproduction of the signs and symptoms is much more important. Now, these all tests are provocative in nature, so when an examiner palpates or when examiner reproduces the symptoms, it should be for 1 or 2 minutes, no more than 2 minutes. So first we'll talk about the Adson's maneuver or the Adson's test. So Adson's maneuver is the most common maneuver when it comes to thoracic outlet syndrome. So the patient is in a sitting position. Examiner first feels the radial pulse, then asks the patient to face towards the shoulder which is examined, and then ask the patient to take a deep breath and hold the breath, and ask the patient to take the head into extension while rotated on the side being tested, and then the examiner takes the patient's shoulder into extension and lateral rotation. A diminished radial pulse indicates that the Adson's maneuver for thoracic outlet syndrome is positive. The second test is Costoclavicular Syndrome or military brace test. So in this, an examiner checks a military brace test or Costoclavicular Syndrome if the patient complains while wearing a back brace or wearing a heavy backpack, or when a patient complains when he or she used to wear a heavy coat. So the patient is in a sitting position, examiner palpates the radial pulse, and examiner gives a downward traction and extension. If the diminished of the radial pulse, that indicates that the test is positive. Third is the Halsted maneuver. So Halsted maneuver is patient is in a sitting position, examiner palpates the radial pulse. So the patient's head is rotated on the opposite side and the head is in hyperextended position while the examiner gives a downward pressure, and if there is an absent radial pulse, that means the Halsted maneuver is positive. Thank you.